Hello, everyone, and welcome to Module 5 for the Plan of Care training. We're going to talk about Plan of Care objectives. So when we're in the Plan of Care and we're developing our goals, we next up would be the objectives to support those goals for that person to work towards. And the definition for objectives ultimately they're more focused in goals. They're short-term, specific, positive outcomes that relate to the person's overall goal. So again, short-term, we want them to be specific so that the person that is working towards their greater goal is able to achieve success as much as possible toward that goal. So we want to make it manageable for him or her in doing that. So objectives, they should answer a few different things. What will the member or client be able to do or achieve as a result of the interventions that are identified? They should be SMART, as indicated through Jessica's review of SMART goals, which would mean they're specific, simple, measurable, attainable, realistic, and time-framed. Objectives should also empower and engage the person to help accomplish that goal in smaller segments, as I just mentioned. You know, they're more manageable, succinct steps to get to the bigger goal that they're working toward. It's going to build that self-determination theory that we spoke about earlier in today's training, where that person's more empowered, they're more willing to engage, they feel like they have more control in their decision-making process if they can attain a smaller step toward that goal, that objective in a smaller measure. And then every problem that the person requests the care team assistance should be addressed within that objective or intervention on a plan of care. So if they have an identified problem, around food insecurity, we should be working toward, assisting with them in that area, so that is no longer an issue, or it's brought down to not be such a significant issue in their life. You can see on the right-hand side of the slide, objectives as they were described earlier when Jessica was speaking. They're broken down into categories to adherence, behavioral health, physical health, social health, and care coordination activities. So when we're developing objectives, we should have a strategy. So we like to look at it as the approach that's described here. If we're able to help you do X, Y, and Z, which we're saying are the interventions, what will that look like for you, the person that's receiving the service? What will you be able to do or achieve as a result of services being in place? So again, you want that person to engage as much as possible. You want them to have control as much as possible in their goal planning process. So if I do X, Y, and Z, if I help coordinate that effort for you, what are you going to in return be able to do or achieve as a result of that? And how does that look for you? So now I want to talk about finalizing the care plan. We want to make sure that it's only marked as final if the person agrees to the plan. Again, it's not your plan, it's not the provider's plan. It is the person, the member, the client that we're working with. It's their plan. So we want to make sure they're in agreement with it before that is finalized in the electronic health record. The signature is only enabled once the plan is marked as final. So you're not going to be able to have a signature unless it's finalized to go ahead and have a signature for the plan. And then you also want to ensure documentation of the plan in the care manager notes. So you want to include that the person participated in the input from key providers of the care team. You want to include that they agreed to the finalization of the plan, and then that plan is going to be completed to be amended or move forward to another addendum if need be. Now we're going to get to I mentioned the care manager note, writing a note. So I want to talk about tips to write an effective note. So when we go to the notes tab in the electronic health record, care manager, on that smart care manager, there's different elements that we want to incorporate when we're writing notes, quality standards, if you will. So we want to make sure they're clear, concise summary of the activities. We want to answer the questions of who, what, where, and when. We want to describe and assess the members' strengths, goals, and needs. Document progress toward resolving those concerns or those strengths, goals, and needs. How's that going? They should be timely. We have 72-hour requirement of the interaction with the member, the individual, that documentation goes into electronic health record. And then that note should always capture the person's progress towards meeting their goals and objectives. So those efforts should be really a consistent flow of documentation to show that progression, to show that journey towards that goal, any challenges or obstacles along the way. And then I have a note at the bottom, just keep in mind the goal or objective, the intervention provided, the response to the intervention, and then the progress made from the last meeting of the care plan. So when we're writing, we should be objective versus subjective. So I wanted to talk about that, what that looks like. So objective writing, that's going to be what you can verify. That's fact-based writing. That's getting to the actual of what's happened, what you've actually followed up on, the actual result of that follow-up. It's not biased. There's no personal feelings involved. And that's really where our focus should be when we're writing in the electronic health record for someone that we're working with. It's got to be objective. Subjective, we want to steer away from that. That's the type of writing where you can't evaluate or calculate or verify. You're getting into your personal feelings and emotions on or opinions on how you feel that person's progress or lack thereof, or challenges or obstacles that they're facing, why that's happening. You're putting your personal feelings into that. So we want to stay away from that subjective type of writing, and we want to make sure that we're really focusing on objective writing. So that note, that care manager note, it's got to be at least once a month for the care manager and within the plan of care. So you got to have one time a month at least a care manager note written in the plan of care. And it should always incorporate the status of that person's identified goals and objectives where it relates to social determinants of health factors, obstacles, and successes. So here's an opportunity to address those social determinants that we talked about in earlier training today in the module for social determinants of health, really looking at those subcategories and how that person's faring, as far as searching for housing, around food insecurity, transportation needs or lack thereof, substance use treatment progress or lack thereof, how that person's doing as far as linking to different providers, et cetera, so that they can work on some of those social determinants that are impacting their ability to be successful within their life. So you always want to incorporate a note and care manager in regards to that.